Hello, my name is Katrina Montano White, and I am with the Tribal Capacity Building Center. I am the subject matter expert for the emergency preparedness, disaster relief, and recovery. And I'd like to introduce my co-presenter for this section.
Hello, I am Althea Zuni. I am the Tribal Technical Assistant Specialist with Tribal Childcare Capacity Building Center. Back to you, Katrina.
Hey, thank you, Althea. Well, welcome to Section 1, Program Administration. In this first training session, we will walk through the components of CCDF administration and some of the flexibilities tribes have in operating their CCDF programs. This presentation will cover Section 1 of your CCDF plan, except for child count, which will be covered in a separate session. We want to highlight that you can see on this slide that the session is for tribes of all allocation sizes. You will see each session slide deck, whether the session applies to your allocation size throughout this training. Although the majority of this session covers information that applies to tribes of all allocation sizes, there are a few exceptions that we will call out as we go through the process. Now, Althea, let's take a look at our objectives.
So Section 1 covers foundational information and assurances for your overall CCDF program. By submitting the CCDF plan, your tribal lead agency assures that it will have in effect a program that complies with the provisions of the CCDF plan and that it is administered in accordance with the Child Care and Development Block Grant, CCDBG Act, and all other applicable federal laws and regulations. In this section, we hope you gain a better understanding of the requirements and flexibilities of CCDF program administration, such as defining and designating a CCDF tribal lead agency, the flexibility to administer the CCDF program through a contract or an agreement, the requirement to consult in the development of your CCDF plan, including the important public hearing. The CCDF defined categories of care, coordinating CCDF services with various child and family programs, CCDF program integrity and accountability, understand the disaster preparedness and response requirements as it applies to tribes with medium and large allocations. We hope you build awareness of your implementation stage of CCDF requirements included in this section. Also, gain an understanding of what sufficient responses are for Section 1. All in all, we hope you walk away with a better understanding of the critical role leadership plays in the overall administration of your tribal nation's CCDF program. Next, we'll review who can receive CCDF funds from the federal government. I want to call your attention to the bottom left footer of this slide. You will see 1.4.2, 1.4.3, and 1.5.1 listed here. This means that this slide covers information from these three sections in the plan. Again, you will see the relevant plan sections in this left footer across all session slide decks. Federally recognized tribes and tribal consortia may apply to receive CCDF funds from the Office of Child Care, either directly as an individual tribe or through a consortium made of multiple member tribes. Tribes are required to designate a tribal lead agency to apply for funding and oversee the administration of the CCDF program on behalf of the federally recognized Indian tribe. The agency plays a crucial role in determining how funds are used and managed, in ensuring the program is in compliance with the CCDF requirements, in ensuring all aspects of the program are administered according to the CCDF plan and internal policies and procedures, and for the implementing the program in a way that meets the specific needs of children and families within the tribal nation and communities. So as you can see, and as many of you know, the Tribal Lead Agency plays a significant role in the CCDF program implementation. We recognize that tribal lead agencies and their structures can and do vary widely across Indian country. In the plan, you will tell us the name of your tribal lead agency, which may be the name of your tribal nation, and or who you designate to operate your CCDF program, such as a department, sub-agency, or joint interagency office. Now, let's look at what contact information is needed. Now, 1.5.2 through 1.5.5 may seem like the easiest piece of the plan to fill out because it's your contact information. But we want to take this opportunity to share how important it is for us to have the correct and current information listed here. We use this information to send official documentation and critical communication, such as grant awards, plan approval letters, Dear Tribal Leader letters for tribal consultation, regular updates about CCDF, and other official communications to the email addresses provided in this response. This information is also shared with other federal partners like the Office of Grants Management, OGM, Child Care Automated Reporting System, CARS, and Technical Assistant TA partners like TCBC. We know that either administrators, tribal leaders, and other email addresses change often, so you will need to submit an amendment to this section of the plan if information changes over time. Now, let's review the administration options. We know most tribal nations choose to administer or operate their CCDF program within the tribe's department structure. However, tribes have the flexibility to contract out a part or the majority of their CCDF operations to an outside entity or agency. These are often referred to as contractors, and they can be government or non-government organizations, other public or private groups, and can either be local or outside of your community. Either way, the tribal lead agency remains a single point of contact and retains all overall responsibility for the administration of the CCDF program. A few examples of how tribal lead agency may contract with other entities to administer or operate portions of the CCDF program are contracting with a tribal nonprofit organization to manage a large portion of the CCDF program, hiring a financial firm to maintain the fiscal portion of the program, like payroll payments to providers, or contracting with child care resource and referral agencies to support the provider eligibility process. In section 1.6.1, you will tell us if you directly administer and operate all aspects of the CCDF program, or whether you use contracts or other agreements with outside entities. Next, let's discuss who you need to partner with in the development of your CCDF plan. As you likely will notice throughout the various sessions this week, the tribal lead agencies need to collaborate with others. Therefore, it is important to understand the needs and priorities of their nations and communities. Tribal lead agencies are required to consult with appropriate representatives of tribal government and the tribal community during the development of the CCDF plan and as practicable. Again, this Collaboration ensures that the plan reflects the needs and priorities of the tribe and families. Tribal lead agencies are also required to make the plan accessible and available to the general public or your community. Lastly, lead agencies must hold at least one public hearing in order to allow the public to comment and weigh in on the CCDF plan as a whole, and specifically on child care research services. The notice of the public hearing must be made no later than 20 days before the hearing, and the notice must be given throughout the tribal nation's CCDF service area. The public hearing must also be held before the plan is submitted to the Administration for Children and Families, which is July 1st, 2025, but cannot be held any earlier than the 9 months before the plan's effective dates. So the hearing cannot be held sooner than January 1st of this year. Feedback gathered during the public hearing should be carefully considered and incorporated if appropriate. In sections 1.7.1 through 1.7.3, your agency will certify the requirements listed there are met. There is a helpful public hearing FAQ resource available that covers strategies and considerations. Reach out to your Office of Child Care Regional Office to access this. Now, let's take a look at one of the most important subsections of the plan. The 3 CCDF defined categories of care are center-based child care, including tribally operated centers. This is group care provided in a facility that is outside of the child's or provider's home. Family child care. This care is provided in a private residence other than the child's own home. In-home child care. Care provided in the child's own home. In section 1.8, you will indicate what direct child care services your CCDF program offers or funds. Selections here will trigger skip patterns or efficiencies throughout the rest of the CCDF plan. So it is important you choose the accurate categories of care here. Do you remember when I said earlier that some elements in section 1 may not be applicable to all allocation sizes? Well, this is the first item that may only be applicable to tribes with medium and or large allocations. Tribes with small allocations are not required to offer direct child care services, so it is possible to not make any selection here other than no. Also, tribes with medium allocations are not required to offer a certificate program with access to all 3 categories of care, unlike tribes with large allocations. So it's possible they select yes only once in this section. Again, in 1.8, you will select only the provider types or categories you either make a subsidy payment to or use your CCDF funds to cover operational cost of, like for a tribally operated center here. If you have a medium or large allocation, you have a deeper dive in direct childcare services in session 6. We understand that some tribes and states may choose to create different names for categories of care such as family, friend, or neighbor. But for the purposes of describing the childcare services your program offers through CCDF, you will need to use the 3 listed on this slide. It is important to note that providing quality-only funds, such as quality grants, to a provider types is not considered direct services. So again, only select the provider types or categories who are providing direct services. So you may have noticed that relative care was not listed on the previous slide. For the purposes of filling out your CCDF plan, you will select either family child care or in-home child care in 1.8 if you allow relative care, as those are the two categories that relative care can happen in. In session 2, we will do a deeper dive into relative care, but we do want to share that CCDF regulations defines a relative provider as an individual who is at least 18 years of age and either a grandparent, great-grandparent, aunt, uncle, or a sibling, if the sibling is living in a separate residence. That means that grandparents, aunts, and uncles could be living in the same home as a child and still be considered a CCDF relative provider. It is important to understand why CCDF regulations define relatives. This is because at the tribal lead agency's discretion, these individuals can be exempt from some, all, or none of the health and safety requirements as described in Section 2 of your plan. It is also important to note that tribes can allow other family members of a child to provide childcare under CCDF, but anyone who does not meet the CCDF definition of a relative as listed in the regulations does not qualify for any potential health and safety exemptions and are treated as non-relative provider under CCDF. Again, we'll explore this topic further in session 2, parts 1 and 2. Now, I would like to pass it over to Katrina.
Thank you, Althea. So 1.9, you will see this pre-populated list of potential programs to partner with. It is important to note that the coordination is required as applicable and to the extent practical. It's possible that not all of these partners exist within your service area and or are other partners that may not be listed that you work with to serve your nation's citizens and community. In this section, agencies will briefly describe 1, the ways coordination occurs, 2, the results, the coordination efforts. In this sample response, the agency states they coordinate with their Tribal Head Start program via regular meetings. So they include the ways and then they briefly describe the results. Children receive full day, year streamlined services, no co-pays for families, are assessed, and all teachers receive the same training across both programs. This is a sample of what a description could look like for one of the partners listed on 1.9. We note that there are many programs your tribal nation or local communities coordinate with that may not be listed here. You have the flexibility to describe those in your response. Now, let's shift to program integrity topics covered in the plan. In this section, 1.4.1, the tribal lead agency ensures compliance by checking the assurance box, confirming that tribal lead agency will have a program in place that aligns with CCDF plan provisions. This assurance is important for maintaining program integrity, accountability, and compliance with federal requirements. Tribal lead agencies can ensure program compliance by conducting regular reviews of internal policies and procedures to ensure they are aligned with federal regulation and tribal priorities. Implement monitoring and oversight measures to ensure CCDF funds are used effectively and in accordance with program guidelines. Ensuring that eligible families receive child care assistance and eligible providers promote child development and school readiness, as well as developing clear documentation and reporting mechanisms to support program transparency. Every CCDF tribal lead agency is responsible for making sure that policies and procedures are in place to monitor programs and services, ensure compliance with the rules of the program, and provide oversight in expenditure of all funds, including identifying improper expenditures and undertaking fraud prevention and recovery efforts, all of which result in program integrity. You might be wondering what an improper payment or expenditure is. Well, it is essentially any payment that your CCDF funds, anything that has made your CCDF funds has made an error. This could be an over or under payment to a child care provider. Tribal lead agencies are required to describe in their plan the processes that are in place to identify fraud or other program violations and how they are in place to investigate and recover those fraudulent payments. In 1.10, you will describe that your internal controls are, and then you will also select any of the options listed in this excerpt in the plan to demonstrate how your agency prevent and identify improper payments. Tribal lead agencies must describe how internal controls, processes, and procedures demonstrate integrity and accountability. For example, a tribal lead agency could describe how the CCDF program staff and fiscal staff coordinate and manage fiscal operations. If further assistance is needed, please reach out to the Office of Child Care Regional Office. On the next slide, we will examine some examples of improper payments. Here in 1.10.2, your agency will select any of the options from the expert to indicate how your recovery improper payments that result in fraud could consider or be intentional errors or program violations that are made. Some options include coordinating with and referring to other tribal, state, or federal agencies like Tribal Council or tribal law enforcement. Also, an option would be require recovery if the improper payment due to fraud exceeds a specific dollar amount. Recover through repayment plans and other options as listed in the plan. Tribal lead agencies have the flexibility to recover other payments made in error or that are not made from intentional errors, but you do not have to describe that in the plan. So now let's discuss the final component to cover all CCDF program administration. Tribes with medium and large allocations are required to establish a child care disaster plan for the CCDF service area. The disaster plan must be developed in consultation with relevant agencies and partners and must describe how it will address the needs of children, including the need for safe childcare before, during, and after a state of emergency. Tribes with small allocations are not required to have a child care disaster plan, but have the option to answer these questions, again, if applicable. This is the other part of Section 1 that is impacted by your allocation size designation. The child care disaster plan must have guidelines for the continuation of child care subsidies, or how you will continue to issue payments to providers. 2, guidelines for those continuation of services, such as allowing for emergency and temporary child care services during a disaster, or temporarily operating standards for child care after a disaster. And 3, procedures for coordination of post-disaster recovery of child care services, which could include how you assess provider and family needs, or responding to a new or additional training or facility that is the result of the disaster. You are not required to describe or submit your disaster plan as part of your CCDF plan submission, but instead, you will be making a checkbox within the sections in 1.11. And our training and technical assistance partners have fantastic resources and subject matter experts who can assist you in this area. So next, we will describe more details, components of the disaster policies and procedures. 1.11.3. All allocation sizes will certify whether they have disaster preparedness and response policies and procedures that are important for all child care providers and CCDF programs to have in place, covering the topical areas you see here and listed in the CCDF plan: evacuation, relocation, shelter in place, lockdown, communications and reunification with families, continuity of operations, accommodations for infants and toddlers, children with disabilities, and children with chronic medical conditions. And last, conducting emergency preparedness training and practice drills for staff and volunteers. This is another question where you will select a checkbox to certify all the CCDF requirements are in place. But also, please note, you will also describe these requirements for CCDF providers in Section 2.3.7 in Standards and Training Requirements for Emergency Preparedness and Response Planning. That section is within your health and safety. So this concludes session 1, CCDF Program Administration. You will see all the topics covered listed here. We invite you to reflect on the next steps for fulfilling this section. This section within you will be filling out. Who might you need to connect with? What partners might you need to discuss your CCDF services with? And do you have any questions about the requirements and how they impact your program? Do you need training or technical assistance to support your program? Well, you will notice similar reflection questions across all various sessions. But both Althea and I would like to say thank you so very much for participating in this section, Program Administration. Lastly, we'd like to share how to connect with us. If you are not already, please do subscribe to our OCC announcements to receive all the latest information. You can see here, that is the link. And you can also visit our website for the various resources that we have mentioned today. Also, feel free to email us at occtribal@acf.hhs.gov if you would like to connect directly. Again, Althea and I say thank you, and we hope that you have a wonderful day.